Um, First, I want to start. Women and girls tend to have more significant prevalence of mental health versus males. Girls tend to suffer from depression at higher rates than males do, girls and women. Um, they're less likely to seek treatment for severe disorders unless if it's pointed out by somebody or specifically asked. Women tend to think that they can take care of themselves a lot. Women, untreated mental health issues. I think women are suffering from depression at higher rates. I think that we tend to try to treat versus prevent. And so some of the trauma that they experience maybe as young adults, as teens, as girls, is left untreated, and so it manifests itself at higher rates now for women, and so untreated mental health issues are alarmingly high for women. As far as resources in this community are concerned, there are a lot of resources for children, more so for children than for adults, and that's just the facts of people want to help children more than they want to help adults. Funders tend to think that women should be able to have their own health insurance and have resources to meet their needs, and that's not always the case. I will tell you that Florida is the second lowest state in mental health funding throughout the country, and Duval County is the lowest county as far as per capita mental health funding in the state of Florida. So we're the lowest of the second lowest state. Obviously, we're going to have some of the results that we have. We also have a lot of crime, a lot of violence, which our children and women are affected by. And so funding has significantly impacted our families, as well as the resources with the privatization of Medicaid. That has some agencies have shut down because of that. Primary care physicians are no longer taking Medicaid. And so you've got then longer waiting lists. And so the privatization of Medicaid has affected it. Cuts from state funding. There's just cuts constantly coming along, which are having a tremendous effect. Not to mention with the economy, and most people get health insurance for women and for their children through employers. And with job layoffs, with our unemployment rate, you then have more women and children relying on Medicaid and other public funding that they used to get through private health insurance companies, and that's significantly impacting. Funding for outpatient, there's not very much funding for outpatient mental health. If somebody doesn't, if an adult woman doesn't have health insurance, there's not very many places that they can go unless if they can afford high rates. There's not many agencies that work off a sliding fee scale. There's not many agencies that even accept Medicaid. And so if a woman doesn't have health insurance, she can't get the counseling that might help treat a mental health issue. And so what ends up happening is that they don't get that level of care originally, so they end up either in an inpatient hospitalization or having significant mental health issues because they were untreated when they could have been, I wouldn't say prevented, but treated earlier on with a less restrictive environment. The effects that has on the family are tremendous. If a female, we know that most single families are female-led. They're single mothers. If they are suffering from depression, if they are suffering from untreated bipolar disorder, PTSD, effects of domestic violence, they aren't able to be there for their child. They aren't able to bond with their child as much. They aren't able to care for their child the way that they could if they were treated. And so the effects on the family it just snowballs for the children. And I think that is one area where there is a lack of community resources, and that is for women who do not have any health insurance, and as well as the postpartum depression issues. We don't address postpartum depression with our women at all. I've heard stories of where a doctor just kind of says, so are you feeling depressed? No? Okay, well if you do, let me know, I'll get you a pill. And that's not sufficient, and it's what's happening. And so the other thing is women, we're caregivers. Mothers are caregivers. We look out for our children first. So we will take the time to make sure that our child has health insurance, that our child has their physical and mental health needs taken care of. And then if we have time at the end of the day, we'll look at our own and so women are less likely to seek out their own, try to get Medicaid for themselves. They certainly don't get insurance plans on their own, because that's $300 or $400 that could go to their children. And so mothers tend to neglect their own health, physical and mental. What's going to make this better, what's going to make this entire situation better in regards to women and children's mental health? Number one is awareness. We need to educate people about mental health, that it's not just your severe psychotic disorders that affect women and children so bad. If you can get the awareness, if people are aware of the effects that trauma has on children, the effects that trauma has on women, and then get the services right away. So I think we need to start with awareness. I think we need to start with prevention programs. I think we need to start with providing all of those services for children and women from the beginning. And then I think we need to do a lot of advocacy. Being the lowest county in the second to lowest state for mental health funding is not acceptable, and it should not be okay. And we need to have stronger advocacy efforts, and let the powers that be know that we're not going to accept that for our women and children. And as long as that continues, it's hard to believe that we're going to make lasting changes unless if we let our women and children know from the top level that they are cared for, that mental health is important, and that we are wanting to make a difference. There's one thing that this poor economy and lack of mental health funding has done in a positive way, and that is to increase the collaboration of nonprofit providers in this community, most especially the mental health providers. We've learned that nobody is an expert in everything when it comes to mental health. You need to start from prevention on through treatment, and there's no one agency to meet all of those needs. We need to build upon each other. We need to provide wraparound for our children and women. And so I think I've noticed that almost all of the nonprofit agencies have decided and realized that we need to work together in order to really make a difference in our community. And funders are looking for more collaborative efforts. And I think that the one thing that has been a positive out of a lot of negative is the fact that agencies are collaborating with one another. You've got coalitions of children's mental health, coalitions of adult mental health. There's a Northeast Florida Behavioral Health Network. There's provider meetings where mental health providers meet. And so you've got everybody kind of collaborating together. Agencies are now, for the first time ever, writing grants together. You know, one agency will do this part, another agency will do this part, even a third agency will do another part. So agencies are definitely collaborating a lot more, and I've seen it more in this community than I have in any other community. And I think that while it came from a negative, it has turned into a positive for this community. One great initiative that has taken place is the Substance Abuse and Mental Health Services Administration, our federal government, awarded the Jacksonville community a $9 million System of Care Initiative grant back in October of 2010, and that was given to the entire community to redesign the way mental health services are provided for children with severe emotional disturbances in child welfare, early learning, homeless, and juvenile justice populations. Right now, while there are a lot of providers, there is no collaboration in the way that the system is designed. And part of that's due to funding, part of that's due to eligibility restrictions. And so this $9 million System of Care Initiative grant was given to this community so that we can change all that. It is focused on a core component that services will be family-driven, youth-guided. So we have gotten families together through the Federation of Families chapter. We're getting youth together through a My Life and a Jacksonville Youth Council to find out from them, from the horse's mouth, you know, what's worked, what hasn't worked, and if they could redesign our system of care, how would they redesign it? And I am proud to say that all of the children's providers, behavioral health, mental health providers have come to the table and are working together. There are 8 different committees. We have a board of directors that includes judges, the state attorney's office, the district attorney's office, school board personnel, United Way. Providers are all working together to redesign the way that mental health services are provided, and it's all based on a wraparound approach. so that children who are entering juvenile justice, child welfare, we know that it takes a full-time job to coordinate services for that child if they have a mental health issue. And so there's wraparound coordinators that will do that for families, and for the first time in a long time, and this is an initiative that was started back in 2006 with the Children's Mental Health Coalition, due to funding through the Jessie Ball DuPont Fund. We started this Children's Mental Health Coalition, and it has led to this, and it is for the first time where everybody's sitting at the table. Everybody is focused on making sure that you check your agency's interest at the door. Here is the opportunity for our community to come together and really work together to make sure that the mental health needs of our children are adequately provided for. With everybody at the table, you can learn what everybody's doing. With funding changes and this grant starts and that grant ends and this initiative is started, we don't always know what each other are doing. I've been in this community for 15 years in the children's mental health, and all of a sudden I find out, there's something that's been going on for 5 years now, and it's a phenomenal program. I just never heard of it. And so the ripple effects of this system of care initiative are that the providers are at the table and we get to network with one another and find out what each other are doing, find out ways that we can collaborate and how we can work together, and then again write grants together to get more funding for our children. And it's also reaching out to parents and helping parents. It's the wraparound approach, so that whatever services the entire family needs, not just the child who's entered juvenile justice with a severe emotional disturbance, but what the entire family needs, those needs are being cared for on a strengths-based approach. 3 wishes for the mental health of women and girls in our community. I would start with that they're properly educated about mental health, that women and girls aren't afraid to talk about it, that they are willing to bring it up to their primary care providers, that they are willing to seek out services. My second wish is that everyone would have access to services, that women and girls would have unlimited access to services, that there's no restrictions if because of hours of operation or because of funding or because of transportation, that the needs of the mental health of our women and children are provided for. And third, that our politicians and those that make funding decisions recognize the detrimental effects that untreated mental health has on our women and girls, that when there is trauma, when there's economic instability, when there is taken out of from their homes because of child abuse or neglect, that the effects that has, and then provide funding to meet those needs. Those would be my 3 wishes.